Good afternoon, everyone. Thank you very much for inviting me to present before this very distinguished body. And also congratulations to the members and the organizers of the PSVM for a very successful 19th annual conference. So I am tasked today to present two very important modalities and the role in lymphedema management. Do compression therapy and manual lymphatic drainage still play a role in lymphedema management for 2022? So there's just a disclosure. I also serve as a consultant medical trainer for Southeast Asia for Lohmann and Rauscher Company. So in the history of lymphatic therapy, we can see that since the 1620s, the description already of the lymphatic system has already been investigated. But it was only 200 years after, in the 1870s, where Taylor Still developed a scientific approach to the manual lymphatic techniques that are very similar to what we do now. In the 1880s, Dr. Alexander von Winnewater very famously specialized or introduced a specialized massage and compression procedure to treat swollen arms and legs. And more about 50 years after Dr. Winnewater's discovery, Dr. Emil Voder rediscovered the Winnewater technique and developed his own method, which eventually became called manual lymphatic drainage. And in the 1980s, good afternoon, and thank you very much for the kind invitation to speak before this very distinguished body. Congratulations also to the organizers and members of the PSVM for a very well-attended and successful conference. So today I'm tasked with talking about two modalities that will play a role when talking about lymphedema management. So the question is, do compression therapy and manual lymphatic drainage still play a role in lymphedema management in 2022? So just a bit of disclosure, I also work as a consultant medical trainer for Lohmann and Rauscher Company, handling the Southeast Asia division. So for the history of lymphatic therapy, we can see that since the 1620s, the description of the lymphatics have already been investigated. But fast forward to about 200 plus years, and we see Dr. Taylor Still formulate a first scientific approach to manual techniques affecting the lymphatic system. And very famously in the 1880s, Dr. Alexander von Winnewater introduced a specialized massage and compression procedure to treat swollen arms and legs. In 1930s, the very famous Emil Voder rediscovered the Winnewater technique, and then he developed his own method, which eventually became known as the manual lymphatic drainage. Of course, we know Dr. Emil Voder as the founder of the Voder School. In the 1980s, Dr. Michael and Ethel Foldy modified the Voder technique, and they actually combined or coined the term Complete Decongestive Therapy, or CDT, which is more holistic in its management of the patient. So we're very famous with these two diagrams. On the left, you would see the traditional four-pillar approach to CDT, Complete Decongestive Therapy. Of course, you have skincare, lymphatic drainage, compression bandaging, and exercises. In the Philippines, though, we included a fifth pillar, and that is self-care, because we want the patients to be able to maintain their goals and their gains long-term. So whenever we practice our profession, we always have to be guided by the best clinical practices that are available in the world. We are basing our profession on several treatment guidelines, and foremost among this will be the International Society of Lymphology. So they recently came out with a 2020 consensus document. In that document, they divided the lymphedema treatment into two parts. You have conservative management and the operative method. For the conservative management, CDT is still backed by long-standing experience. The consensus document also defines compression garments alone as having some use, especially in early stage and even beginning stage lymphedema. As a matter of fact, more advanced countries actually promote the use of compression stockings immediately after mastectomy. However, data on the garment use alone, especially for late-stage lymphedema, is very, very limited. Another important aspect that the consensus document focused on is the fact that manual lymphatic drainage is indeed a special kind of treatment. You definitely need further training, specialization, and it's not a run-of-the-mill massage as what others may expect or mistakenly identify. We are also guided by the 2018 Medical Compression Consensus. This was reached by the American Lymphedema Framework. It says here that the best practice for the management of lymphedema is still a multidisciplinary approach, and that is what we know as complete decongestive therapy. The compression garments definitely can be used for prophylaxis, stage 0, stage 1, and it is highly important to use these compression garments, especially with more advanced and pronounced lymphedema. The medical compression framework also categorizes the different kinds of compressions available. So you have elastic compression, which are your circular knit stockings, and you also have inelastic compression system, which are your multi-layer bandages, your adjustable compression wraps, and your padded foam garments, which are usually worn at night. Also, very important statement is that compression is the component of therapy that has the greatest impact on minimizing hospitalizations. So from here, we can see the importance of choosing the correct kind of compression garment, be it the right size, length, indication, and even the compression class. A fairly new guideline that was released recently is the one done by the American Venous Forum, American Vein and Lymphatic Society, and the Society for Vascular Medicine, coming out with an expert opinion consensus on lymphedema diagnosis and treatment. So although this guideline was made in America, they actually have a very, very distinguished pool of advisors coming from Europe also. So among these advisors are past presidents of the International Union of Phlebology, past president of the International Society for Lymphology also. This was written by Dr. Lurie and published at the journal Phlebology in 2022. And a very, very significant statement here is that the panel agreed that manual lymphatic drainage should be a mandatory treatment modality. And this is in stark contrast with some countries in Europe, for example, in the Netherlands, where depending on the severity of case, some of them choose to manage only with compression garments. But for the US consensus, definitely manual lymphatic drainage is mandatory. A consensus was also reached favoring the regular use of compression garments to reduce lymphedema progression, almost 90% in favor. And the newer Velcro devices, we call them adjustable compression wrap, did not reach consensus. But remember, this is Velcro used as first-line compression therapy. So for me, first line should always be your compression bandage. Velcro may have a role, especially towards the maintenance phase. Another key statement is that there was agreement that sequential pneumatic compression pumps should be should be considered as adjuvant therapy in the maintenance phase, but less so in the initial phase. So the kind of compression pump that's talked about here are the newer chambered pumps. They have between 8 to 12 chambers, and they include the proximal trunk quadrant. Regarding the use of lymphoscintigraphy, there is still no consensus reached regarding the routine clinical practice of using lymphoscintigraphy to diagnose lymphedema. I would say that for the more clear-cut cases of breast cancer-related lymphedema, then there would be very limited use of lymphoscintigraphy as a mandatory diagnostic. For treatment outcomes, on the other hand, we definitely have to look at the literature to see if there is still some improvement using CDT and compression therapy. So first study we're looking at looks at the effectiveness of decongestive lymphatic therapy, that's your CDT, in patients with lymphedema resulting from breast cancer treatment, regardless of previous lymphedema treatment. This was an American study from MD Anderson and published in 2017 in the Breast Journal. The purpose was to compare the effectiveness of CDT in patients who received prior lymphedema treatment versus to patients who have not received CDT before. It was a retrospective medical review of 98 patients, and the primary outcome measurement was a % change in arm volume via perometry. This study showed that decongestive lymphatic therapy, or CDT, reduced the lymph volume very significantly, regardless of prior treatment from lymphedema centers. A second study we're looking at is the clinical effectiveness of decongestive treatments on excess arm volume and patient-centered outcomes in women with early breast cancer-related lymphedema. So this was a UK study and published in 2018. The definition of early breast cancer-related lymphedema was a development within 12 months or a mean of 9 months from the date of surgery. This study reviewed 5 randomized clinical trials and 2 descriptive trials. The study summarized that there were some evidence that CDT was effective for women, and the findings provided no justification to support change to current practice, meaning that in the absence of any new findings, then the status quo or the use of CDT is still recommended. The third study we have showing a treatment outcomes is this study, which was published which was done in Turkey and published in the journal Cancer Reports in 2020. So this was a retrospective evaluation of 57 breast cancer-related lymphedema who received CDT between the years of 2014 and 2016. And the response to treatment was evaluated using percentage reduction of excess volume formula. The previous study used perometry. This study used the truncated cone method to compute for percentage volume reduction. And this study showed that the median percentage reduction of excess volume was a very significant 27.7%. Also, interestingly, the study showed that a history of skin infection, which is probably a cellulitis or erysipelas, was related to lower percentage reduction of excess volume. So part of that could be due to the chronic inflammation and the heightened immune response with a skin infection. So in summary, we can see now the trend of lymphedema is really going towards a multidisciplinary approach. So no longer are we just confined with a single specialty, but we have now a team of physicians who are actively engaged in furthering the patient outcomes in terms of lymphedema management. So this is very particular in Europe, where you have heads of national lymphedema centers who are not vascular doctors. Some of them are actually dermatologists, as in the Netherlands. In Czech Republic, the head of the National Lymphedema Center there is also actually a dermatologist. Clearly from the evidence, we see that MLD alone, and I'll venture that especially for advanced case of lymphedema, compression garments alone will not be significant in reducing lymphedema by themselves. So the best practice at the moment is to combine manual lymphatic drainage and your compression bandaging. So we really have to apply the principles of complete decongestive therapy. This last statement is actually a grade A recommendation stating that there is good evidence that the active phase of complete decongestive therapy is effective in decreasing lymph volume associated with lymphedema. Also, I will add that it's very important that we have a very good maintenance phase, because we are also looking at the long-term outcome for our patients. So with that, we have very good evidence and also very good clinical practice guidelines showing that CDT, compression bandaging, lymphedema massage, skincare, and exercise is still very much preferred as the treatment of choice when dealing with lymphatic disease. So thank you very much.